Hello, I'm Dr. Shashank Shetty, consultant nephrologist and transplant physician at Aster CMI Hospital. So today I'll be talking about ABO Incompatible Transplant or transplant across blood groups. So when do we do transplantation? So a lot of times somebody on dialysis, what is the option for these patients? Either to continue on dialysis or to undergo transplant. So of course transplant is a very good option in these patients. So what is transplant? Transplant is basically we replace or we give one of the kidneys to the patient, and this takes over the kidneys of the patients. And over time, this transplant or the transplanted kidney takes over the function of the native kidneys. What we are experts in doing a type of niche transplant, which very few centers in India do it, we call it as ABO Incompatible Transplant. So what is ABO Incompatible Transplant? So a transplant patient should be blood group match to go ahead for the transplant. We in our center in Aster CMI, we are experts in doing ABO Incompatible Transplant, where we do transplant across the blood group, where the blood group barrier, which is a barrier for transplantations, overcome either by doing some sort of plasmapheresis, which is a type of a dialysis, where we reduce the antibody level in our patients and then we overcome this blood group barrier and do the transplant in our patients. We have had a good number of patients who have undergone ABO incompatible transplants, and the results have been excellent in our patients. Traditionally, ABO incompatible transplant is a hindrance for transplantation. However, at our center, since we do ABO incompatible transplant, we have overcome this barrier. ABO incompatible transplant increases the donor pool. That is, any member of the family with a blood group mismatch also can go ahead and give their kidney for transplant. This increases the donor pool, brings about better results because they are a family matched donor and the results have been better. And in our center in Aster CMI, we do it at affordable and good cost, and we have seen very good results in our patients. So anybody in their audiences have doubts for all this, they can come to our department and clarify their doubts. We'll be more than happy to help them.